Watch where you're going!
Hi.
Hey guys, so what's up? This is Larry Bryan here, another video featuring Jenny. Yeah, so I got an email from one of you guys asking me to do a video on the topic of clinics and what it's like changing clinics and how you go about picking different ones and what different ones are like. So today we're driving. We're gonna go to the beach and talk to you guys, but it's Florida and it's cloudy and raining. So instead we're gonna go to my parents' house and have dinner. But on the way, I want to answer this question for you guys. So I've been to 3 different clinics in my adulthood, which is, as you guys probably know by now, is when I really started getting sick and it actually mattered what my clinic was. So Jenny was in a particular scenario. Jenny had a unique mindset to where when she started dating me, she didn't understand the patient side of things because she's a respiratory therapist. So she saw it as, you know, she was teamed up with the doctors and just talked to patients, and you know, that was it. She didn't understand that there was different personalities and positivity, negativity, and all that really actually matters a lot when it comes to your care. So my first clinic, I've had 3 different ones, and my first clinic was where I met Jenny at in Colombia. And what do you think?
Well, I didn't know any of the negatives of that clinic, obviously, because I don't know, we just didn't see that side of it. I mean, I would see the CFers all the time giving them treatments, but I had no idea how it was outside of the hospital, or even I never heard any of them complain about their inpatient stays. So I had no idea until, well, you probably vented about it. I think Brian was always doing research on what the heck the doctors were doing, so I think I kind of got an idea then. But I got to see a different side of them when we started dating, for sure.
Yeah, the clinics are really important. Like, you know, a lot of patients, and you guys might be like this and that's okay, but a lot of patients literally listen to what their doctor says. You know, the doctor's God and that's gonna be it, and whatever they say goes. And I've always really researched what they told me and, you know, try to be on the same playing field. And I think it's really,
Sorry.
freaking truck pulled out in front of us. But I think it's really important to be on the same page. Like, you want to be a team with your doctor. You don't want to have your doctor be all, you know, overpowering and tell you this is how it's going to go, and then, you know, you go home disappointed and discouraged, and, you know, you want to take charge of your care and feel like you're in a team environment, because you're going to be way more positive that way, and you're just overall going to be happy about taking care of your health. You know, you're not going to go home depressed or crying or disappointed because now you're on this new medication and you don't understand why and this and that. So first of all, the thing is, it's really important to be part of the team. In Colombia, they treat you as part of the team, and that's awesome. I really enjoyed it. That's kind of like what I learned from, I guess you'd say, compared to other clinics.
I will butt in and say, but you trusted Columbia. Well, you were that person who trusted your clinic until they started making mistakes.
Right.
And that's when he started researching.
Right, that's true.
A big life lesson learned.
I was someone that totally trusted the doctors. You know, I didn't know too much until I really started getting sick and how to go about things. So I trusted them. Anyway, once they started kind of making mistakes or fumbling here and there, I really started doing more research and realized, you know, things weren't done the way they should have been, or I didn't agree with certain things. So it's really important. So that first clinic I had, the only downside about them was they were very negative. And that was more or less, they'd come in and say, you know, this is CF, this is how it's going to be, there's nothing you can do about it, see ya. And so I didn't like that. That was really discouraging, and I was always someone that's optimistic and positive. And as you guys might have listened to my CF story, there was many times where they told me I was gonna be on oxygen the rest of my life, insulin the rest of my life, you know, this and that, and I didn't agree with it. And I think truly because I didn't agree with it and I believed I could get off of those things, I ended up where I am today, where I'm not on those things. All right, so the first clinic I was at, it was great as far as, you know, they let me be part of the team. We made decisions together, and overall, I feel like it was a decent clinic. Like I said, the negativity was bad. Just outlook on live, you know, sorry you have this disease, this is the way it is, you're not gonna be able to change anything about it. That was really bad, especially when things got really bad, like when you start going in a lot and your lung function dropped lower, they kind of pushed you off, if that makes sense. They were really like big fans of transplant, like as soon as you can get it. So like when I got low, and I know a couple other CFers, when they got low, it was immediately like, okay, you need to go get a lung transplant evaluation, and you know, go get checked out for a lung transplant, blah, blah, blah. And they weren't a hospital that did lung transplants, so you had to go to a different one for the evaluation. So that I didn't like, because I felt like when things got really bad, when you need them the most, they seem as if they didn't know what else to do, and they were just shoving you to someone else.
It was very hard to trust them at that point.
Right, after that, you know, you start to lose trust, and that's never good to lose trust in your clinic. So the second clinic I went to, the way I actually picked that clinic was, once I did that lung transplant evaluation, I loved the doctors. You might have seen my CF story, but I said I love the transplant doctors, and they're really nice and really trusting. So we decided, you know, let's try this clinic. You know, if I didn't need lung transplant at the time, but they had a CF team too. So let's try them. They're 2 hours away from my first clinic. Anyway, so that's a whole life-changing, eye-opening experience, because we went there thinking they were a bigger hospital, they do transplant, they have a transplant team, they have a CF team, it's gonna be so awesome, and it turns out that's not the case.
No.
You know, you would think bigger, better, but that's not always true. That CF team was separate from the transplant team, so they, you know, the doctors interact and talk with each other, but if you have CF, you don't need transplant yet, you only see the CF team. So the CF team, I did not agree with on a lot of things, and they were not very...
You could not communicate with them whatsoever. Yeah, at all.
You were not part of the team there.
No.
What they said goes, and if you did not obey, you got kicked off transplant list, or you were frowned upon.
Or they threw something in your face telling you, this is the way it is, you're not going to feel great, you're suffering from a disease that's going to end up taking your life, and they would just throw everything in your face to make you shut up, like if you questioned anything.
Right. A perfect example was, I was in the bed, sick, you know, as I was having frequent exacerbations. I was sick one day, and one morning the doctor was coming in, and I said, hey, you know, have you thought about this or thought about that? You know, he just said, hey, you know, this is what I went to school for. So, I think we're doing the right thing. And it's like, look, I'm freaking in the hospital every 2 weeks, and you guys are trying everything you can, and you have no clue what's, you know, making me sick. So why don't you let me help out a little bit? Anyway, it's not like I knew more than him. It's just, let me be part of the team. Let me trust you, and let's try to tackle this together, rather than me be in the dark. So anyway, another scenario at that same clinic was, you know, he walked in another day, I think that actual same admission, and said, look, you know, you're gonna die within 2 years if you don't get a transplant in September 2015.
Yeah.
It's September 2015 right now, and I'm the best I've ever been.
I mean, they
once
were
I started getting sick.
So pessimistic. They were awful.
Very. So that was a really like eye-opener, because it's one of those hospitals that you think, you know, you want to be at. If you need transplant, that's where you want to be. It would be great because they have a CF team, so it's easy to transition to the transplant team because they already know you. So why wouldn't you want to be at that hospital? But that's not, I mean, it sucks that it's that way, but it's not the best place to be if you don't get along with the CF team.
So we had to march our butts back to the clinic in Columbia because somehow they were better than that one, the other pessimistic clinic.
Right, so what Jenny just said, we ended up at the first clinic because we felt like we were at least more part of the team at the first clinic. You know, we could communicate with them and try different things and agree on what we're trying instead of just feeling depressed and in the dark and not able to do anything except let CF kill you. So that was our second experience.
And then H1N1 hit, and that clinic acted like we needed to get the hell out of there.
Yeah, I got sick with H1N1, and that first clinic that we went back to totally acted like, they had no clue what to do.
Yeah.
And lung transplant evaluation, they said I don't need one yet, and they encouraged us to move to Florida, which is where my parents live, and see the clinics down there. They had transplant team and stuff like that. So we ended up shortly after that moving to Florida for better health care, and we went and vacationed to Florida first to make sure we wanted to move there. Met up with the CF clinic there in Tampa.
Well, how I found them though, which I think is part of what this video is we got advice from, I don't know where it was, on choosing clinics to look up what people thought of the clinic, and you will see that most people talk about the nurse coordinators.
Right.
Like in most clinics, the nurse coordinators are who you need to trust, are always going to be there for you, or who you are in communication with all the time. And so that's how we found the clinic we came to now. I researched and found out that Tampa
And when we say
General-
research, guys, you can, you guys, I don't know if you understand the power of Google.
Yeah.
But you literally go on google.com, anything you want to know. I taught myself app development through this crap. You literally go to Google and just search, cystic fibrosis clinics in Missouri or Florida or California, wherever you are, and just read what people say. Or you can even type a question in there. What CF clinic is best in Missouri? And it's not going to give you a defined answer, but what you're looking for is you're looking for forums where people are chatting back and forth about what clinic they are at, what they like, what they don't like, what clinic they suggest. You're not looking for any site telling you, hey, this is the #1 rated clinic, blah, blah, blah. You want people's opinions. So that's what we did. Like Jenny was just saying, she literally found on forum somewhere that, the important thing is to do, look at the nurse coordinator. We were reading forums for probably 4 or 5 days every night, and they were saying how great Tampa is because her name is Sue Roberson, whatever you say it. Sue. Was so great and wonderful, right? And she's the nurse coordinator. So we contacted them, we went and visited them, and they are amazing.
Yep.
I've never been admitted there, and I'm a firm believer on you can't judge the doctors until you're admitted. Because that second clinic we went to, they were decent people in the clinic. But when we were admitted, it was hell.
Yeah.
So I'm a firm believer on that. So I haven't been admitted in Florida yet, thankfully. But just clinic-wise, Sue is so helpful. No problem emailing you back and forth right away with whatever you need to know. They're really, really intelligent. We found out things there that we've never been told before at a CF clinic, especially when it comes to calories and diet and enzymes and stuff like that. And then on top of that, the first visit we were there, they said, I improved a lot. You guys see my story. I had gained 30 pounds. I gained lung function. So I had improved a lot. So they saw what I could do. But the very first visit, she literally told us, yeah, but you're not going to need transplant. So don't worry about it. You're going to be great. And right off the bat, they were positive. Extremely positive people. And even now that I'm on Orkambi or Cambi, whatever the heck it is, I'm on that now. And my last lung function was 44%. And she said, congratulations, and the doctor said the same thing. You aren't gonna need lung transplant at this point. You keep going like this, you're good to go for life. So, positivity is a major thing to look for.
Yes, and one other thing just to add on, remember when our first visit, she was like, yeah, but you're not gonna need to be admitted. Remind you that Brian was admitted every 2 weeks, forever, and after we moved to Tampa, never admitted.
Right.
Positive attitude is everything.
Because we were asking, the typical questions like, hey, when you're in, we had just let that second clinic, so we were all worried about what they're going to say. So we're like, what's your view on airway clearance, and what's your view on antibiotic resistance and stuff like that. And it was questions that you would ask, because if you were admitted, that's what you'd have to worry about. And that's exactly what she said. She said, this is what we do, but you don't need to worry about that. You're not going to be admitted. You're going to be fine. And that's the mindset you need to have.
Yeah.
yeah, we have CF, yeah, we might be admitted, yeah, we might get sick often, but don't think like that. If it happens, it happens. And so that's really what attracted us to this clinic. And we've been there for a year now and still love them. Just, she makes, the nurse coordinator there makes the clinic.
Yeah.
The doctors, you know, they have a team of 3 doctors, and I hate how there's always a team of doctors, because then it's like, it's great to see different views, but then you don't know who you're seeing that day. And
of course, you always have a favorite, and they're never there when you want to ask something.
Right, you have a favorite, you have a least favorite, things like that. So I hate that part. But anyway, the nurse coordinator makes it, so we are so happy with them. Unfortunately, but fortunately, we are planning to move soon, and we have a road trip next week that I'll do a video on. But so I'll be searching for a new clinic again.
Yes.
But this isn't just because of healthcare, though. This is, thankfully, for the first time in my life, we're not moving for healthcare.
Yeah.
But anyway, so guys, keep in mind, when you go search for clinics, if you're moving away or you would just want to find a new clinic or whatever it is, go to Google, see what people are saying, check out the nurse coordinator, check what they say about her or him, whatever it is, check out the nurse coordinator, and just get people's opinions and look for positivity. And you definitely want to be part of the team when you're there. You don't want them to rule everything. You want to feel like you can trust them and that you guys are working together to make you better. You know, you are there because you have CF. They're getting paid because they're treating you because you have the disease. So you are an important part of the care. So really focus on those things when searching for a clinic, and you guys will be good. You'll be very happy with your choice. I hope so, at least.
Yes.
All right, guys, so we are getting over this bridge, and I got to close my eyes, cross my fingers, cross my toes, because I'm scared of heights.
But not hold your breath.
Don't hold your breath, especially if you have CF, because who knows what's going to happen. But anyway, so I'm going to wrap up this video. It's already getting long. We're about to go over the bridge, and I will talk to you guys later. See ya.